Today's presentation covers competence to make treatment decisions. I'll explain key legal standards of competence in treatment decisions, how informed consent works in mental health contexts, and how clinicians assess competent decision-making. Milton explains that informed consent, although familiar today, is a relatively recent legal doctrine. Physicians may face responsibility for battery or negligence if they treat without valid consent. The primary purpose is to protect autonomy, encourage rational decisions, and protect patient well-being. A valid consent requires three elements: appropriate disclosure of information, competence to make the decision, and voluntariness of choice. An example of appropriate disclosure of information would be when a doctor explains how a medication can help reduce symptoms as well as possible side effects or other treatment options with the patient. The patient is given all of the appropriate information to understand the treatment and what it involves. This patient is given the right amount of information about the treatment and what it can do. Competence to make the decision would be after the doctor explains the treatment, the patient repeats back what they understand the treatment is and the purpose of it, explaining how it relates to their own issue and informs the doctor if they want to accept or refuse the treatment. This shows that the patient has the capacity to understand and make a rational decision about it. Lastly, voluntariness of choice. When the patient agrees to treatment for themselves, knowing that even if they were to refuse the treatment, there would be no consequence to such action. They did so without any coercion and freely. Melton describes 5 competence standards developed by Roth and colleagues. The simplest is expression of preference, if someone can indicate a choice. Next is understanding, knowing the disclosed information. Appreciation is the ability to apply that knowledge to oneself. Reasonable decision-making involves comparing alternatives logically. The highest threshold is reasonable outcome, where the choice matches what a reasonable person would make. Each of these reflects a different level of required decision-making, and courts may use them differently in practice. This video illustrates how informed consent and competence operate in real treatment decisions. It highlights the tension between protecting autonomy and ensuring understanding. For this project, I recommend this segment because it explains how clinicians must ensure patients understand risks and benefits before proceeding. This connects directly to Melton's decision of disclosure and competence standards. Melton explains that disclosure generally must include the nature of the treatment, its risks and benefits, and alternatives. Courts recognize several exceptions: emergencies, when the patient waives disclosure; therapeutic privilege, where the disclosure would preclude rational decision-making; and when the patient is incompetent and a guardian consent is required. However, Melton warns that some exceptions, like therapeutic privilege, must be carefully limited so that they don't swallow the disclosure rule. Voluntariness refers to freedom from coercion or undue influence. Melton notes that this is a legal concept, not purely clinical, and the law has inconsistently applied it. In mental health settings, pressures from institutions, caregivers, and even informal staff influence can affect voluntariness. Competence and voluntariness overlap because someone might understand information fully, but still make a choice under pressure. In Case Study 11.2, Mr. Bowman refuses a recommended trabeculectomy. Although he expresses concern about blindness, he cites voices and his mother's ineffective surgery experience as reasons. Melton prompts us to consider how each competence standard, expression of preference, understanding, appreciation, reasoning, and reasonable outcome applies here. His understanding may be present in abstract terms, but appreciation and reasoning could be impaired because the reasons he gives are rooted in delusion or misapplied beliefs. In summary, Melton's chapter shows that valid consent requires disclosure, competence, and voluntariness. Competence can be assessed using 5 different standards, each with its own implications for autonomy and protection. Because courts have not articulated clear rules, practice can vary widely. A key discussion I have for this class is, which competence standard do you think best balances protection and autonomy in treatment decisions?